Good evening, and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services and Workforce Development Committees. I am Councilmember Priscilla Tyson, Chair of the committees. Before we begin, please be aware that tonight's hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. The subject of tonight's hearing is to discuss the Mayor's 2016 proposed operating budget for Health and Human Services and Workforce Development. The speakers for tonight will be Health Commissioner Dr. Teresa Long, who will speak about funding for the Columbus Public Health. Hannah Jones for the Department of Development will present on the social service funding. And Executive Director Amy Long will speak on the workforce development initiatives. I will start with Health and Human Services. The city's health and social service funding provides an opportunity to serve most of our vulnerable residents. In a moment, I will invite up to speak Health Commissioner Dr. Teresa Long. We rely on the Health Department to address a multitude of public needs, which requires them to track and investigate health problems and hazards in our community, prepare for and respond to public health emergencies, develop and apply and enforce policies and regulations that improve health and ensure safety, and also they lead the efforts to mobilize communities around important health issues. I would like to highlight that Columbus Public Health has played an important role in responding to potential cases of Ebola, and you will also hear from Dr. Long about new initiatives to address that she's going to be addressing in her area, infant mortality and the opiate addiction. And I will now turn this hearing over to Dr. Teresa Long. Good evening, Dr. Long.
Good evening, Council Chair, and I guess it would be Health and Human Services and Workforce Development Committees Chair Tyson and colleagues. So good evening, and thank you for the opportunity to highlight Columbus Public Health's proposed 2016 budget. I think I will just, if it's okay with you, Council Chair Tyson, quickly go through some of the testimony that I gave the other evening, since we have a different viewing audience and a different participating audience. And of course, I'll be happy to respond to questions. I will say up front, I'm joined right here by my colleague, William Chip Livesey, who oversees our alcohol and drug programming. Unfortunately, our colleague, Erica Clark-Jones, who heads up our community initiatives around Celebrate One, is actually at the Near East Area Commission as we speak, another community meeting. So I think hopefully I'll be able to respond to all the questions if there are some connected to that. So as you know, and as you already mentioned, our Columbus Public Health team has worked hard to keep our community healthy and safe during the many complicated challenges faced by residents in 2015. No one could have predicted the Ebola outbreak in West Africa and its impact on our resources and capacity. Even in the absence of a local actual case, we have monitored nearly 500 travelers on a daily basis. We have managed 17 of these travelers who were hospitalized and needed further and obviously very careful evaluation by our local hospitals, collaborating with our many partners, including the Centers for Disease Control, the state of Ohio, every local hospital system, Columbus Fire and EMS, and of course many others. So our work in this area has been extensive, and our monitoring and response came with a price tag of more than $500,000. And that cost is on top of all of our other public health challenges, which include, as you mentioned, a record high infant mortality rate, and of course, numerous outbreaks, which included a significant syphilis outbreak that will still take a long time to curb due to its complicated nature. I believe our commitment to protect health and improve lives in our community is more important than ever. And for us at Columbus Public Health, obviously, is our #1 priority. The proposed 2016 budget allows us to continue provision of public health services that are mandated, as well as priority programs that the Board of Health deems minimally essential to meet Ohio's public health standards. We also will continue our services and programs that further protect health and improve lives. Additionally, we continue to focus on significant efforts to reduce the infant mortality rate through Celebrate One, which is responsible for the implementation of the Greater Columbus Infant Mortality Task Force's recommendations. We also will continue to lead the work of the Southside Network for Healthy Families and Babies, both critically important projects given the number of infants that die before their first birthdays. Likewise, our budget prioritizes and proposes maintenance in clinical programming. Our primary care service contract with Primary One Health Centers is budgeted to receive $4,799,110, the same amount that was budgeted for 2015. Additionally, both Access Health Columbus and now doing business as the Healthcare Collaborative of Greater Columbus and the Community Garden contracts will receive level funding. Related, and as you mentioned, to two important expansion initiatives, the proposed budget reflects an increase of 7 full-time equivalents, which is predominantly related to our new harm reduction initiatives. The first proposed expansion addresses I apologize. This first proposed expansion addresses a developing crisis in our community. As you are aware, the opiate epidemic plaguing Columbus and communities across our state is not going to go away anytime soon. As a community, we need to look at the systems we have in place, as well as increase awareness and treat it as if this disease, which it is, a chronic, relapsing, often devastating disease, that it really is. We also need to provide adequate treatment and support. Columbus Public Health will be partnering with a local service organization to launch a comprehensive harm reduction initiative that includes intervention with treatment and counseling for the addiction, testing for hepatitis C and HIV, naloxone distribution, which is an opiate antidote, and access to clean syringes. This, of course, is all a first step in addressing the crisis. The new initial project will be called SafePoint, which will have a soft launch this January. And again, we believe that we must act now or the consequences will be even more tragic. The second expansion initiative is part of a long-term commitment to the well-being of children in our community. Columbus has an infant mortality rate that is higher than 37 of the 50 most populous U.S. cities, and our African-American babies are dying at 2.5 times the rate of that of our white babies. In order to be effective in the work in the neighborhoods worst affected or most affected by this crisis, we are looking to place community or neighborhood leads that will be the front line of the neighborhood work and connectivity. And ideally, these will be trusted members or have a close understanding of the residents within the initial targeted neighborhoods, and who will continue the committed work in each of the initial neighborhood and, again, provide facilitation for ongoing community meetings and for neighborhood interventions. There will be some funds allocated for neighborhood interventions that, again, provide direct connectivity and support for all of the partner agencies that will be and are willing today to bring services and support to improve the quality of life in these neighborhoods. I recognize that on Tuesday evening we did discuss this, and it was terrific to hear our Development Department Director, Steve Shoney, speak directly to this important work from the Development Department's aspect as well. Let me assure you that your investment and the city's investment in the Columbus Public Health infrastructure and our services means better public health protection is available to our residents, enabling us our ability to meet the diverse needs of our community. We will continue to operate with high efficiency and effectiveness to protect the health and improve lives of all of our area residents. And as always, we do continue to appreciate the support and guidance of you, Council Chair Tyson, as well as Columbus City Council through this process, and of course all year long. And I would be happy to answer any of your questions and look forward to others who may speak as well. Thank you.
Chip, do you want to make some comments about this issue?
Thank you, Councilwoman Tyson. Yes, the issue that we're faced with heroin abuse in this community has become at a crisis level. And I think this effort we have with the potential partner will allow us to serve people who are at a different point in the spectrum of substance abuse in a way that is respectful of them and allows us to save lives and reduce infectious disease. The role that we will play will be a supportive role, and we will allow us to provide some counseling services in addition to what the partner will be able to provide, to be able to interface with some transitional age youth and younger people around issues of suicide and also to be able to have some internal help for some of the infrastructure that needs to happen in order to make sure that this program rolls out smoothly and we're able to address what we anticipate will be issues that will continue to come up as in the first initial phases of this project. So we're excited about that. It's an opportunity to serve the residents and hopefully get it as ahead of this as best we can. And we know that this is going to be a long effort, but we welcome the opportunity to be part of that.
Just want to find out, what does success look like after year one? Dr. Long or Chip?
What an excellent question that is. So success will be, first of all, having an initiative that is up and running, that is, of course, meeting both the state statute as far as what that programming needs to look like, and of course being able to submit information both back to our Board of Health as well as to the state. So to meet our legal requirements, we have had our interested parties conversation, and indeed are very appreciative of many, many diverse segments of our community coming together. What we'd ideally like to see is, of course, starting to see active participation, persons who are coming for addiction and treatment services, who are interested in learning about moving through that door to recovery. Also being able to, for those who are not able to cease, and we don't anticipate it will happen on day one, their injection drug use. So again, the ability to work with our colleagues in our police department to assure that persons who are receiving clean syringes are actually doing so and not at risk of trouble with our law enforcement, which we don't anticipate. So that too would be a win. And again, we would love to see that we are able to provide naloxone to family members and loved ones, so that again, we are able to see that if need be and an overdose occurs, that lives are actually saved. So again, looking for, if we want to call it bystander saving of lives, that we can count that. And honestly, and I believe Dr. Dave Kessig from our medical director for Columbus EMS is here, we'd love to see that we're starting to see a slowdown in the number of EMS runs that our Columbus EMS is making. And honestly, we work very closely with our coroner. We'd love to see a reduction in the numbers of deaths that are occurring from opiates. So we have a lot of things that we'd love to see. I think ideally we're hoping to give away about 750. I don't know if that's over ambitious, but as far as to serve persons who may want to receive naloxone, I think we've kind of looked to the 500 to maybe maxing out at about 750 persons who might actually be receiving naloxone through that mechanism. And honestly, we also have others who are looking to be partners with us and with the AIDS Resource Center Ohio. That's our initial partner in this. So again, we look to be working more with partners. And again, it's both around the alcohol, but really the drug treatment services, the education and prevention education. And so working with family members and affected persons with that, but also around the infectious disease area. So there are many metrics that we're going to be looking for to at least get started to be able to count in the first year.
Thank you. Welcome my council colleague, Councilmember Jiza Page is here for the hearing, and thank you for being here. Dr. Long, how do we, and this is something I know you and I have talked about that a lot, but how are we going to reach our at-risk populations? And we know that there's certain populations that are numbers that are high in terms of, STDs. I'm sure that's kind of the same numbers for, most of all is attributed to a lot of drug use and abuse. And so how are we going to reach those populations?
Well, and Council Chair Tyson, and good evening, Council Member Page. So this is an interesting population. We know we've already gotten a lot of attention just from even talking about this being a part of a city budget proposal. However, this is not necessarily the population that we're really trying to reach. So it will be much more of an outreach and engagement, word of mouth, on the streets. Clearly, we at Columbus Public Health, but we believe many of our partner agencies may well be serving persons who are in this population already or word of mouth. We were talking just this afternoon about the outreach and engagement strategy, and it will not just be us alone at Columbus Public Health. Obviously, our partner agency, and really in this case, many agencies, we hope will help spread the word. As well as our court system, we have been already actively working with the ADAM agency as well. So we hope that we'd love to be busy on day one. It may not be day one. So indeed, if we need to do more, we will obviously, and I know you and I chatted already about more hearings, more community outreach. So again, we're hoping for a soft launch to learn some about how this works, but we certainly want to build this to reach as many of the affected persons and their families as we can.
And my last question, I know that certainly the city is funding a lot of this program, and you think we're going to have discussions with like the county and other organizations to support this effort?
So I appreciate the question again, Council Chair Tyson. So the city is funding, and there are a couple of positions, as Chip mentioned, that are directly connected to this. But indeed, our partner agency, the AIDS Resource Center Ohio, is stepping forward with resources, and we believe that the ADAM board, through one or more of their partner entities, will also be stepping forward to be a partner even in the initial programming. And as this would expand over time, we would hope that others will be coming with resources as well. So again, I don't think this will only be a city initiative. Clearly, the city has a strong interest both in the prevention and education side, but obviously in the infectious disease side, and we clearly see that as part of our role.
Thank you. Councilman Page, do you have any questions? Thank you. All right, Dr. Long, thank you very much. And just excited about the one, I didn't speak about Celebrate One, but certainly very excited that we are having neighborhood intervention leads that will be working with our communities. That's critically important. You want to speak on that?
I do, just for just a brief moment, because on the harm reduction, there are several new positions, and as you're well aware, Council Chair Tyson, we also obviously have tweaks between grant funds and general funds every year, so that's part of what's a part of our overall budget picture. But on the Celebrate One initiative, all of these resources that will be new to the coming to us through, we hope, City Council's approval, will actually be going out to community agencies. So again, it's not a huge amount of money. We will be working with 3 neighborhoods in this way to place community liaisons in community agencies in the most affected neighborhoods, and then also sharing with them some resources for them to take on initiatives that are really resident and neighborhood driven. So again, all of those resources will be going out to other agencies. They will not be staying with Columbus Public Health.
Thank you, Dr. Long. Next, we'll have a presentation from Hannah Jones, who will be covering the Department of Development's social service efforts.
Good evening, Chair Tyson, Councilmember Page. This evening, I will be presenting the portion of our department budget that supports our social service agencies and the services they provide to Columbus residents. The overall human services budget will remain at $5 million, $2,627,000 from the general fund, and $2,373,000 from the Emergency Human Services Fund. $4.1 million of this budget will be allocated to the 31 organizations that were awarded grants through our competitive process last year. These organizations administer 39 programs that address the needs of Columbus residents in 3 priority areas. First, safety net services around emergency and basic needs for our residents, economic success focusing on employment and self-sufficiency, and social success focused on safe and healthy individuals and neighborhoods. In early November, we convened a meeting with the leadership of each organization to discuss the first year and our next steps moving into the second year of funding. We have requested that each organization submit a very simple application made up of a budget and performance measures and outcomes for 2016. These will be due to our program manager, Kim Stantz, on December 11th of this year. We anticipate notifying organizations of their awards on January 15th. Pending the passage of the city budget in February, we anticipate encumbering funds and putting forward contract legislation for council's consideration in early spring of 2016. 2016 will be focused on building the capacity of these organizations and programs in order to create outcomes that are achievable, meet the goals of the funding, and help tell the story of each program's success. The department will also continue its partnership with 3 organizations that provide important services to the City of Columbus. A renewal of the contract with Adam H. for $288,799 for their continued work with youth in the area of alcohol, drug, and substance abuse awareness and prevention. A renewal of the contract with Hands On Central Ohio for $192,659 for the intake and referral services they provide to the residents of Columbus through the 211 phone and resource database, as well as their website. And finally, a renewal of the contract with Community Research Partners for $133,784 to provide community data access, technical assistance, and conduct specific partner research projects for the City of Columbus. In addition to the $5 million that is being provided for the programs I just described, the Department of Development will be providing $5,214,650 to the Community Shelter Board for their continued work to address the issue of homelessness within our city. I would like to invite the Executive Director, Michelle Heritage, to the podium to discuss the work of the Community Shelter Board and the programs that this funding supports. Thank you.
Thank you. Good evening, Michelle.
Hi, welcome back.
Thank you.
Good evening, Chairwoman Tyson. I'm Michelle Heritage with Community Shelter Board. Your incredible and long-standing support of basic human needs has made a significant impact, rebuilding thousands of lives. During last year, we responded to a significant increase in homelessness among families by opening a new family shelter and increasing homelessness prevention efforts. A new task force of key community leaders is being formed to identify, improve, and create services to keep families in their homes and halt an over-reliance on the emergency shelter system. Thanks to your support, our new system for single adults is showing promising results. Through the Navigator program, more than 660 single men and women were assisted by navigators to move from shelter to housing in the last 19 weeks alone. By developing permanent supportive housing, our communities made a major impact in addressing long-term homelessness, saving more money for jails, hospitals, and other systems. There are over 3,000 units of permanent supportive housing in our community, and nearly 2,200 of those are for people experiencing long-term and chronic homelessness. We brought on 643 units of supportive housing in the last 5 years alone, and because of the excellent results of our community across the system, HUD has awarded us $1.5 million in federal funding to bring on even more units this year. We will continue to work hard to bring these types of federal funds to Columbus. And we are one of 11 founding members of the new Affordable Housing Alliance of Central Ohio, seeking to expand affordable housing options in Columbus. We understand that while homelessness among families has doubled, your resources have not. But you've entrusted us to lead a homeless system that ensures safe emergency shelter and services for Columbus citizens who truly need it. As the voice for 19 provider organizations and more than 12,000 people experiencing homelessness, we would not be doing our job if we didn't ask for enough funding to meet the growing need, and that request is $7.4 million. This includes funding for the street outreach team that looks for people living on the street to help them get to safety of a shelter or a home where they can get the services they need. The mayor's proposed budget does not include the $117,000 needed for this critically important service. I want to thank you for your incredible support over the last year. You've rolled up your sleeves and served meals at the shelters, and you've tirelessly spoken about the need for safe shelter and affordable housing for our most vulnerable citizens, and I thank you for that.
Thank you. Thank you, first of all, for the work that you do each and every day. You have an incredible team that works with you. And I know that this year we have level funding, and certainly know there are requests that you need for what you did last year through a council amendment, and for the $117,000 for the street outreach program. Mm-hmm. Now, of course, we have to wait to see what end of the year. Hopefully, we'll have additional dollars and to be able to fund some of the priorities that the council has, even though everything we're funding is a priority already. already in the budget. However, I think that there's still significant needs that we have funded that we know that are important to our community. And so I think we'll have to wait to at the end of the year, and our council colleagues will kind of talk about this particular issue. But I'm very thankful that you are a member of the Affordable Housing Alliance. I know you and I have spoken many times about the importance of, people are homeless, and until that's the key, they're homeless, and even if we give all the other services that they need, they still are in need of that affordable home, and just appreciate the work that's going on. And we certainly know what the need is. The number is pretty significant of what we need the affordable housing units we need to have in this community. But I'm sure collectively, with this total community working on this, we'll begin to make sure we can continue to have more affordable housing for individuals. I know Councilmember Page has also been to the shelter to serve meals, and just appreciate the work that she, and I know Councilmember Harden has also been out, so to see firsthand what's going on within our community. So I appreciate you coming down. I'm thankful that we have the continuation funding, and certainly will, as we get through the end of the year, have more conversations around the budget for the other needs that you have.
Thank you, appreciate it.
Thank you. Hannah?
I have no further presentation, and I'm happy to answer any questions that you may have.
Thank you. The only question I will ask is, since this is the first year of our new program for the competitive process for funding social service agencies, and the meeting that you had in November, can you just give me a brief overview of how you think that the program's going so far?
Yes, I would be happy to. It has been going well. It took a bit to ramp up. Our contract process is something that always needs to be refined. So we took this as an opportunity to not only change the process itself, but look at what we were asking for, how we were asking for it, and ensure that we were establishing a good relationship with the organizations and a good baseline to move forward on. So a lot of this year, Kim has focused in a very coordinated way with each of the organizations to begin focusing in on their performance measures and their outcomes, look at their capacity, and really ensure that both the funding that's provided is adequate, but also that we are tracking accurate measures to be able to give City Council and the administration the updates they need to evaluate this program on an ongoing basis. So hopefully next year, as we move into the third year of funding, we can really begin to give you some accurate data that shows how this is working on an ongoing basis.
Thank you. And again, so the city is in human services to provide to the community with the Community Shelter Board and social services about $10.2 million.
Yes, ma'am.
All right. Thank you. Councilman Page, any questions? Thank you. All right. Moving forward, thank you. And the next presenter, we will transition now to workforce development. And employment is important to our quality of life indicator. It's extraordinarily difficult to enjoy a high quality of life without access to reliable work that provides a decent wage. We have an unemployment rate of 3.6%, which is the lowest that we have seen since 2001. It is still difficult for many in our community to find work. And the unemployment rate in some neighborhoods is higher than the rate of our county and our region. The city is addressing workforce development by investing in job training. Under the Department of Education, the city will continue to fund a job training program, and Councilmember Page chairs the Education Department. We will be having fund a job training program at Columbus State Community College. The Columbus State Fast Path program will be maintained without additional funding in 2016 by utilizing the carryover funding from this previous year. This program is designed to identify and connect at-risk, underemployed, and unemployed adults to technical skills and employability training. I also have Executive Amy DeLong in attendance today to discuss the Civil Service Commission, their workforce development program. And I see the president of, I don't say COWIC anymore, it's COWIC.
Ohio means jobs.
Ohio means jobs. President Suzanne Coleman Tolbert. And I will now turn the podium over to Director DeLong.
Thank you. Chair Tyson, Councilmember Page. As you know, the Civil Service Commission is a part of a checks and balance of the city government and is responsible for maintaining the merit system of employment to ensure the city's employment is accessible and filled with qualified, competent individuals. To that end, the commission's budget request for 2016 is just over $4 million. However, one of its expected expenses falls underneath the workforce development tab, and that is for Restoration Academy at about $273,000. The Restoration Academy is not only a second chance for individuals who have been incarcerated, but a new beginning. The program is a rigorous work experience program for individuals who have criminal backgrounds. Participants go through work readiness training and receive numerous wraparound services. They also have an opportunity to complete specialized training programs, which can result in recognized certifications that increase their qualifications and their hiring prospects. The ultimate goal is to help the Restoration Academy graduate secure permanent employment. This program has been successful because we are able to work with great partners. This year, the City of Columbus partnered with COIC, Ohio Means Jobs, the Urban League, the Alvis House, Impact, Community Action, Hinkles and McCoy, the YMCA, Columbus Public Health, and Columbus Neighborhood Health Centers, and others. And we're happy to get new partners because that means we're able to utilize those resources and those expertise among those groups. The Restoration Academy budget pays for basically the salary of some of the participants who are going through the training program, as well as the Restoration Academy coordinator who works with the participants and partnering agencies and coordinates and supports the planning and participation of the program. With that, I'd like to turn this over to Suzanne Coleman-Tolbert of COIC to talk more specifically about the program.
Thank you.
Thank you, Director. Council Chair Tyson and Councilmember Page, thank you for the opportunity to give you a few more specifics about Restoration Academy, which we're all very, very proud of. With the 4 successful graduating classes of Restoration Academy, the results have been indeed praiseworthy and a testament to removing community-held notions about restored citizens. These individuals have shown extremely high motivation, dedication, and desire to overcome personal barriers through performance while employed. Their commitment to success cannot be questioned. My colleague, the director here, has already talked about our esteemed steering committee of community-based organizations who, without them, this program really would not exist. Along with your support, they have given their time, energy, and qualified staff without any additional funding to make sure that these individuals receive all of the wraparound services that they may need during the process. Since 2012, 114 of the 139 participants have found gainful employment, with 2/3 of these graduates now working in the private sector. Furthermore, 82% of the participants who have graduated are still working 2 years or more. And I just think that that's a fabulous outcome. City of Columbus placements, 38 for Restoration Academy, have proven to be extremely successful with retention of 83%. And in 2014, Restoration Academy implemented changes by increasing the numbers of participants with each class to increase the number of private sector employers providing gainful employment with benefits. And this was the ultimate goal for the city, who set such a wonderful model to encourage employers to hire those individuals who had skills, who had experiences, but who needed that other chance. Sometimes a second chance, sometimes a third or fourth chance. In 2015, all 49 graduates obtained permanent employment in high-demand occupations, for example, business and professional, healthcare, IT, transportation, and other industry sectors. To quote one of our 2015 graduates, "This program has allowed me and my family the ability to not just rent a home, but to purchase our own home." That was a quote from our graduate, Garland Porter. And Councilmember Chair Tyson, thank you so much for all of your support. You come out to the graduations, and the graduates definitely look forward to you showing up each and every time. Although there will be increased emphasis towards employment in the private sector, Restoration Academy will continue to work with the City of Columbus and Franklin County to secure work experiences within their various departments, hopefully leading to that permanent job. I want to speak just a little bit about the proposed design of the steering committee that's made up of all of those wonderful partners that were named, identified a subcommittee to take a glimpse at the last 4 years, to do an assessment, to do a deep dive in, what had really happened with all the graduates, what their needs are moving forward, taking a look at some of the needs of our employers here in the city and around Franklin County. And they have come up with some preliminary changes that we're not really prepared to talk about in a lot of detail, but along with discussions with you and other council members, we want to propose that because of the resources, the wonderful resources that you all provide, some of the resources that are coming from the Department of Labor, that we look at shortening the period of time that individuals go through the program and try and get them employed sooner, doing a more intensive work readiness program with them up front. Some of the feedback we got back from the employers is we really want to hire these people sooner than 6 months. And, I think we would be remiss to hold them back from that opportunity. So with that, I just want to thank City Council, specifically you, Council Chair Tyson, for, again, your support. Councilmember Page, we're looking forward to working with you with this continuation of the program. We've got a great partnership going on, and we think that this is a promising practice, soon to be a best practice.
Thank you, Director DeLong and Director Coleman-Tolbert. This is really an amazing program. It is, as you know, I come because I know that everyone needs another chance. And once you meet the individuals that are in this program, I mean, it's just amazing to meet these individuals. You see that they have skills that our community needs, and that they need a program to be able to have a better life. And the work that the two of you have done and the teams that you just mentioned, all your partners, but the two of you have certainly been integral to making this program such a success. And certainly I want to thank the mayor for his vision to really start an innovative program. There isn't anyone in the country doing this program, so it is really a best practice. I can't wait till this summer. I'm bringing the National Black Caucus of Local Elected Officials are coming to Columbus in July, and we want to showcase a best practice. And since it is the National Black Caucus, and certainly in just understanding kind of what happens within the criminal justice system, I think this will be a program that everyone will want to go back and try to emulate, because it's getting people back to work, and they're back to work, they can take care of their families. And so I'm so thankful that the two of you and your whole team is working on this program. The question I'm going to ask is, what's the number of individuals that you are planning on having in the program for 2016?
Well, so far, the subcommittee is looking at having 2 cohorts made up of 20 individuals per cohort. Now, we currently have 120 individuals who are on a waiting list, just, waiting for the opportunity to participate. But that is the planned goal, is to serve 40 individuals. We are proposing to shorten the time from 6 months to 4 months, with, again, the more intensive work readiness given over a 2-week period of time by our partners and our collective staff. And I just want to insert the work that Ms. Cradle and my whole team have done. Without them, there would be no program. I just wanted to insert that. And I have my team here, and Tarika has done a fabulous job as well, so just wanted to add that.
And I think you just made a good point that right now there's 120 people on the waiting list. And we know there are many more after they hear this hearing, they'll be wondering, how can I be a part of that program? And I want us to say that too, because they need to hear, people out in the community need to have that, know that information. How could they become a part of Restoration Academy? So the need is absolutely there. And I will ask this question. So if you had additional funding, what's the cost for a class of 20?
I happen to have the budget right here. We're estimating that the 2016 Restoration Academy budget would be $562,000. Now, of course, a portion of those dollars hopefully would be supported by the city. COIC would continue to support, and then there are other funders that we would be asking to help with that support as well as the private sector. And we're in the middle of developing a white paper which would accompany a proposal that would be sent to prospective funders. But that is the budget, and that would include the 2 cohorts.
And of that budget, $273,000 is what's proposed in this budget, correct? I think that's right. Yes. Okay. All right. Well, thank you. And this certainly is a program that changes lives, family lives. So thank you for your work. Councilman Page, any questions you'd like to ask them? No? No, thank you. Thank you.
Thank you.
All right, thank you. So now we're going to move into the public comments portion of the hearing, and we will start now. The first speaker is going to be Nick Nelson. He's speaking on behalf of the syringe access, and he is for this in the budget. Mr. Nelson.
Good evening, Chair Tyson. My name is Nick Nelson. I'm on the board of and volunteer with Compassion Outreach Ministries of Ohio, which runs Como Recovery, which is a long-term residential faith-based drug recovery community for men and women in their 20s and 30s. I am also a family nurse practitioner at a primary care clinic at an integrated community health center offering primary care, mental health care, and addiction recovery services, including elements of harm reduction in downtown Columbus. I also have a background in public health and have worked as an epidemiologist at a local hospital research institution and on a variety of community health programming. At my current practice, I serve a population with a high rate of drug abuse and treat addicts in various stages of recovery, ranging from active use to those considering recovery to folks with years of sobriety under their belt. In addition to the social, mental, and physical tolls drug abuse takes on a person, injecting drug users carry additional risks of contracting diseases like HIV and Hep C. I've seen firsthand the high rates of Hep C in our community, in particular in the injecting drug use population, and I've struggled to get them the expensive treatment that they need to cure Hep C and prevent the cirrhosis and liver cancer that it inevitably develops into. The costs of managing Hep C and HIV on the health system are great. A course of the new Hep C treatment is over $80,000, and the cost of managing cirrhosis, liver cancer, and liver failure, the eventual outcomes, are much greater. The lifetime estimated cost of treating someone with HIV is as much as $650,000, according to the CDC. In the IV drug-using population, these diseases can be prevented with simply access to a clean syringe costing less than $1. Comprehensive harm reduction is a common sense and necessary intervention for the public health approach to controlling hepatitis C and HIV in our community, especially with the current heroin epidemic in central Ohio. Not only can clean syringes and other injecting equipment reduce hepatitis C and HIV rates in the IV drug-using community, but syringe access programs can serve as initial access points into the healthcare and recovery systems. While clients of syringe access programs may not initially be interested in recovery, they know that there are people out there who care about their health and well-being, and while their drug use is unhealthy, they care enough to give them access to equipment to stay as healthy as possible. The relationships and rapport built during these interactions may serve to facilitate a user's entry into recovery in the future. Comprehensive harm reduction programs that include syringe access not only aid in preventing infectious disease in our community, but serve to fight the heroin epidemic as well. All over the world, comprehensive harm reduction, including syringe access, is recognized as a cornerstone of mitigating the impact of drug use on our communities. With the current heroin epidemic in our community and rising Hep C rates, now is the time for Columbus to catch up with the rest of the world, what they've been doing for decades to prevent Hep C and HIV and help IV drug users access recovery services when they are ready. So I'm asking for support for the budget, and in particular the Comprehensive Harm Reduction Program. Thank you.
Thank you, Mr. Nelson, and you certainly were shared with us why this program is so important. And I love what you said that, you know, syringe access will, obviously, if we're giving the syringes, they have to come and get them, that then they will be in an environment where maybe they'll have better access to other services. And I really do think that's a great outcome for it. So thank you for coming and sharing all your experience and in support of this being in our budget.
Thank you.
Our next speaker will be Karen or Jennifer Leffler. Good evening. Welcome to council.
Good evening, Councilwoman Tyson. I'd like to tell you a little bit about myself. I'm a recovering addict. I have just over 6.5 years sober. I actually worked with you in City of Columbus in '99 and 2000. This isn't about me. This is about all of the people that are dying from this heroin epidemic, from drugs and alcohol, the disease of addiction. I'd like to tell you one of their stories, if I may, if that's okay with you.
Absolutely.
I had a friend named Justin Grant, and he was born August 22nd, 1983. He died November 24th of 2015 from a heroin overdose. He was a typical boy. He grew up in the suburbs of Grove City. He had Mexican heritage. He was very proud of it. He adored kids, and he was a huge one. He had a parrot named Paco. He had a dog and a kitten. His favorite color was green. He liked taking pictures. He did not seek help due to the stigma of this disease. He did not feel comfortable reaching out. He was afraid of criminal charges being pressed against him, so he did not seek help. And so he passed away due to this disease. He is just the story of many, many. Being in recovery, I have lost 47 to heroin in the last 6.5 years that I have been sober. Many do not seek treatment due to the stigma that is attached. A lot of people see it as the man that is under the bridge, the homeless guy on the street, and that's not the case. This disease does not discriminate. It does not care if you are a CEO. It does not care if you are a child that grew up in the suburbs, if you are a mother, a daughter, a father, a son. It does not care. I think that the biggest issues, there are many issues surrounding this disease. I think the biggest probably is the stigma. People do not seek treatment because they're afraid to be judged. They do not know where to go because it is kept so under the wraps. They do not want to talk about it because they're afraid of being judged. They're afraid of being thrown in prison. They do need to have consequences. They absolutely do. But I do believe that if they seek treatment, they know that they are actively participating in a treatment program, they are more likely to reach out if they're not fear of turning away. I know the stigma for me. I also have epilepsy, and the paramedics were called out to my apartment about 3 years ago to come and get me. I was having an episode, and the paramedics assumed that I was an overdose. And they treated me like a piece of dirt until they found out that I was in recovery and had 3.5 years sober. And then their attitude towards me completely changed. And that is why a lot of people do not seek treatment. It is such a deep-running disease that is so misunderstood and could save so many different lives. I think that counseling outreach, those are very, very important things. You know, it is plant the seed by getting somebody to come in to get a clean needle. Might plant the seed, and maybe someday they will seek further counseling, further treatment. You just never know. I did not stay sober. I bounced around the rooms of AA and NA and recovery for 2 years. And eventually it stuck, and I was one of the blessed ones that are here. So I come and speak on behalf of the angels that are no longer with us, that cannot fight the fight anymore. Thank you.
Well, thank you for coming and certainly sharing your story, and appreciate that. We need to think about, make sure people don't have a stigma against it. I think it's just about educating individuals about, I think we're getting there, about if you happen to, it's an illness, just like having, I tell people, it's just like if you have diabetes, or if you have, it's an ongoing illness, and we have to treat this, because no one, if you ask anyone, do you want to be on drugs? Do you want to be addicted to drugs? No one is going to say, yes, this is exactly where I want to be. But once you go down that road, it's hard to get back without a lot of help and you wanting to change. And so hopefully through the work of people like yourself, Dr. Long, the new team on harm reduction, and what Chip is here, is that we have to, I think, make sure people understand it's an illness, just like any other illness, and it has to be dealt with every day as it is an illness. And certainly, I'm sure that because of the program that we're starting, Dr. Long has been working with the Division of Police, and so part of that is making sure that everyone is, culturally competent as to that it is an illness and how do you treat people. So I thank you for your testimony, and I am very excited that we are going to be implementing this program in Columbus and to help to save people's lives.
Thank you very much, ma'am.
Thank you. Our next speaker is Joe Diaz. Good evening, sir.
Good evening. It's great to see you. Councilmember Tyson, I'm Joel Diaz, Chief Marketing and Community Affairs Officer for AIDS Resource Center, Ohio. Today I'm speaking in favor of the current budget proposal, specifically as it relates to the comprehensive harm reduction effort plan to combat the opiate epidemic in Central Ohio. Approval of this budget will allow AIDS Resource Center, Ohio, in conjunction with the Columbus Public Health Department, to continue planning and execute a comprehensive harm reduction program for Central Ohio to address the current opiate epidemic and help prevent a public health crisis. The plan calls for a comprehensive care model that will include intervention, treatment and counseling, HIV, hepatitis C and STI testing and care, syringe access, as well as overdose prevention through increased access to naloxone. The program, called SafePoint, is being designed in response to Ohio's increasing opiate epidemic and a new state law that took effect in October, which allows syringe exchange programs to operate with oversight by local public health departments. In 2012, Columbus was one of 8 Ohio cities identified as heroin hotspots by the Ohio Department of Health. Columbus is currently the only large city in Ohio without a comprehensive harm reduction program. This program will form part of ARC Ohio's harm reduction strategy being implemented to reduce the negative consequences associated with drug use, reduce the overall level of drug consumption, and help prevent new HIV and other bloodborne infections. Research by the World Health Organization clearly demonstrates that syringe access programs do not increase drug use. Comprehensive harm reduction programs that include syringe access are a financially sound way to prevent the costly burden of treating HIV and hepatitis C. According to the Centers for Disease Control, the average cost of distributing a clean syringe is about 97 cents compared to a lifetime cost for treatment of an HIV-positive person, which is estimated at nearly $400,000. Medication costs to treat a person for hepatitis C can be as much as $100,000. For more than 30 years, ARC Ohio has worked with marginalized communities that have dealt with the issue of stigma and shame related to health. We are in a unique position to create a program that will help save lives and provide people who inject drugs a path towards recovery. As the first step towards a more expansive set of harm reduction services, ARC Ohio, through its subsidiary AMC Ohio Pharmacy, was the first public pharmacy in Franklin County to dispense naloxone, a medication used to reverse opiate overdose without a prescription, in late September. I'd like to thank Dr. Long for helping to champion the changes at the state level that will allow us to move forward with the legal protections needed for staff and clients to have a safe, supportive, comprehensive program. Councilmember Tyson, thank you for your longstanding support of our organization. I ask you to please support the proposed budget, especially the Comprehensive Harm Reduction Initiative. Thank you.
Thank you, Joel, for coming down and speaking on behalf of the harm reduction program. I know that your organization will implement this program in a way that will certainly change people's lives. And working with Columbus Public Health and other community members to make life better for people. And thank you for coming down this evening. I cannot wait for the budget to pass and we can begin to implement this program and change people's lives.
Thank you so much.
Thank you so much. Our next speaker is Ms. Rob Alexander. Good evening, Mr. Alexander.
Good evening, Chairwoman Tyson. My name is Rob Alexander, and I was recently hired as the new Executive Director of the Human Service Chamber of Franklin County, an organization that I know that you're very familiar with. The Chamber represents 53 human service agencies, each of which is doing incredible work right here in Columbus. And I know that you see the value in what they're doing too, because the Council has chosen to invest city funds with more than 20 of our member agencies. So I want to say thank you. If you remember nothing else I say tonight, I hope you know that your generous support of the human service sector is greatly appreciated and it's not taken for granted. I'm sure you'd agree with me that these agencies are providing a great return on that investment. I've been spending a lot of my time lately touring our member agencies, and I have to tell you, it's really hard to walk out of each one of those agencies and not be inspired by the way that they're impacting people's lives. One of the reasons why the Human Service Chamber exists and continues to be needed is because there are challenges that people in our community face that simply cannot be addressed or fixed by one single nonprofit. These systemic issues will require a smart, coordinated, and community-wide effort if we're going to move the needle. The Human Service Chamber is uniquely positioned to partner with the City of Columbus to confront these difficult challenges. With a single phone call to us, we can canvass our members and provide valuable feedback to you, saving you a great amount of time and effort. When it's time to act, we can mobilize our members in an incredibly efficient and effective way. You know, we have a saying at the Chamber, one voice, one community. It pervades everything we do. Why? Because we know that if we can get all of our human service agencies in the same room to hash out a plan that involves each one of them in a small or large way, when we speak loudly with one booming voice, then there's no challenge greater than our will to solve it. It's true that a rising tide lifts all boats. Well, I came here tonight to say that when the members of the Human Service Chamber unite and when we speak with one voice, everyone who calls Columbus home is better off. There are no winners and losers. Thank you very much for supporting not only our member agencies, but for the grant that you provided to the Human Service Chamber in 2015. It made a tremendous difference in our effectiveness as an organization, and I confidently believe that the City of Columbus is better off because of it. I'm looking forward to working with you more in the future, and I appreciate the chance to speak here tonight. Thank you.
Thank you, Mr. Alexander, and I'm excited that you have taken on the role to lead the Human Service Chamber. Absolutely, those 53 agencies do wonderful work in our community, and I know that, as you mentioned, we fund about 20 of those member agencies, but also funding your organization. I absolutely believe that your organization needs to continue to be strengthened so that you can continue to support those organizations. So thank you for coming down this evening, and we look forward to talking to you in the future.
Thank you.
Thank you. Our next speaker is David, is it Kesson? Okay, good evening. I'm so used to seeing you for safety or the judiciary hearing. Good evening.
Good evening, Chairperson Tyson.
Thank you.
I'd like to thank you for the opportunity to speak on this very important issue. I'm the medical director for the Columbus Division of Fire, and I've served in this capacity for almost 29 years and have been an emergency physician for 35 years. And I'm testifying here tonight in favor of funding the Columbus Public Health Department's proposed comprehensive harm reduction program for heroin and opiate abuse and use. As the medical director for the Division of Fire, I review all the cardiac arrests that occur here in our community for the quality of EMS care. And at least once a week, unfortunately, I read an EMS report that has a narrative that goes something like this. Medic 18 called on an unconscious 19-year-old male found by mother in bed. An empty syringe was lying by his right arm. Numerous needle tracks were noted. Mother is doing CPR as we arrived, and she is in tears. She relates that her son had just gotten home after spending a month in drug rehab. She said he has had a 3-year history of battling drug abuse, including heroin. Patient has no signs of life, including no spontaneous respirations or pulse. Patient is intubated and artificial ventilation is provided. EKG shows asystole. IV established, Narcan, epinephrine, and bicarb are given with no effect. The patient is pronounced dead at 18:30 and seen released to the police. Our community is in the throes of a medical epidemic that's stealing the lives of our young people, and it cuts across all demographics and geographic boundaries. In 2015, the Columbus Division of Fire is averaging giving Narcan, or naloxone, which is the medication for the treatment of opiate overdose, to patients on an average of 6 times a day. Our emergency departments are overrun by the other consequences of opiate abuse, including heroin withdrawal, abscess formation, hepatitis B and C, premature labor, and other adverse outcomes. The general health of our community has been negatively affected by the effects of opiate abuse. In 2012, the Ohio Department of Health designated Columbus as one of 8 cities in Ohio as a heroin hotspot, and yet we are the only large city in Ohio that does not have a comprehensive harm reduction program. This program would address both prevention and treatment of opiate abuse, but 2 major features of this program would save lives and prevent serious medical complications. Number 1, the syringe access program would help to prevent the spread of blood-borne disease such as hepatitis B and C and HIV in populations who inject their opiates. By providing clean needles and syringes to individuals who choose to continue to use injected drugs, we are not only preventing these deadly infectious diseases from occurring in this patient population, but also can reduce the overall incidence in the general population. This results in a major improvement in the overall health and welfare of our community. Number 2, the access to Narcan by family members and friends provides a life-saving treatment that has been proven to be effective and teachable to the general population, so that the first person on the scene of an opiate overdose can administer the medicine that can reverse the deadly effects of the opiate and bring someone back from the dead. This is the same medicine that our paramedics administer, and so the earlier it can be given, the better chance the individual can survive the overdose. Some might question this strategy and say that by instituting these interventions, we will be promoting drug abuse and making it easier for individuals addicted to opiates to continue their habit. To this contention, I would say that this is unequivocally not the case. In every instance of a harm reduction program going into effect, the incidence of drug abuse has never gone up, and in many cases has gone down. With this particular program, there are elements built into it that deal with substance abuse treatment, such as assessments, group therapy, outpatient treatment, detox services, and medication-assisted treatment. These elements are in keeping with the established fact that, as you correctly pointed out, Chairperson Tyson, drug addiction is no more of a lifestyle choice than diabetes, high blood pressure, or cancer. It is a disease and should be approached as such. Medical research has proven that addiction is related to neurochemical and biophysical changes that occur in the brain that make this disease a very difficult one to treat and especially hard to cure. The harm reduction program being proposed here has many beneficial aspects and recommendations which are tried and true and have been proven to be impactful for the communities that they have served. For example, in San Francisco, after instituting a similar program that included home Narcan use, their EMS system had a decrease of 30% in terms of Narcan administration by their EMS system, and the lives saved by this program are incalculable. So I would strongly encourage the Columbus City Council to provide the necessary funding to make this harm reduction program a reality here in Columbus. because our community deserves to have the very best resources appropriated to combat the deadly effects of the heroin epidemic that we find our community engulfed by. Thank you for the opportunity to testify here today, and I'm happy to answer any questions.
Thank you, Dr. Kasich, for coming down and giving this testimony firsthand from the Division of Fire, but overall just sharing the importance of this program. The one question I'm going to ask is, how are we going to train family members to be able to give the Narcan at home and things of that nature?
I'll have to defer that to Commissioner Long because I think she'll be in charge of that. So, Commissioner?
Council Chair Tyson and Dr. Kasich, first of all, thanks so much, Dr. Kasich. And he didn't know it, but we're going to put him in charge of all the education. Just kidding. No, in fact, it's an excellent question, Council Chair Tyson. So indeed, there's actually some very good guidance about how to go about doing this. So we have actually been learning from other entities, both around our country and obviously around our state. There are video presentations. We were actually just talking about this today, that we would likely share both written but also a video presentation, but want to have a clinician available to be able to, as we are training family members and loved ones, so their questions can be answered. Again, there are different mechanisms in which the naloxone can be administered. There is both a nasal spray, which many people are familiar with that, though again, there's also something similar to like an EpiPen, an auto-injector, another mechanism. So again, some family members may want to use one as opposed to the other, so we will try, and in some cases there may only be the nasal spray available. Others may want to have the auto-injectors because there'd be different rationales for those, but we will be in charge of working both ourselves but also potentially with partner agencies and being sure that we are meeting both the requirements, but obviously meeting the educational needs and being able to have anyone who would administer naloxone feel confident in doing that.
Well, thank you for sharing that, not only with me, but the viewing and listening audience. The only other comment, I'm so excited that that this is in the mayor's budget, and hopefully, as a chair of this committee, I certainly want this to be approved by this body of council. What this makes me think about is certainly we've talked about how this could help with, HIV, Hep C, Hep B. People would not get those illnesses. But they also have to think about the number of people. If we're saying that we have an epidemic in our city, that means, and that epidemic happens to be people. And what are the resources around in terms of the social service agencies to be able to help these individuals that are, like any other illness. We need to make sure that we have enough beds, enough programs to be able to treat these individuals. So I think as a community, we have to start thinking like that, because when you say an epidemic, that means there's lots of people who are affected by it. And oftentimes, and again, most of the time, if you have not necessarily any illness, but when you have, I think, drug abuse, or you're addicted to drugs, the first time may not just work. It's like the first, the second, or the third, or the fourth time, and it does require resources to be able to get treatment. And so we've got to really begin. I'm always thinking ahead. This is one part. Just like I think about we need affordable housing for homeless, that once we identify these individuals, how are we going to get them that ongoing help that they may need? And that's something we need to think about as a community. But I thank you for coming down and giving this wonderful presentation on this program. Thank you. And our final speaker for tonight is Mr. Reed Fraley from the Primary Health. Thank you for coming down this evening.
Councilwoman Tyson, thank you for inviting us tonight. For the sake of identification, I'm Reed Fraley, the Chief Operating Officer of Primary One Health, and we really appreciate the opportunity to speak with you tonight about the things that Primary One Health is doing and the many programs partially funded by the city's efforts and with the support of Columbus Public Health that we believe are helping address the mission of the city in terms of our overall mission. I'll find my piece of equipment here, which is quality health care for all. Our mission basically is to figure out how to provide care by breaking down any barriers that might be in the way. I like to call it care, healing, and helping. Our probably most visible activity this year was changing our name. So we used to be known as Columbus Neighborhood Health Centers, and now it's Primary One Health. Our history is rooted in the same thing, which is 40 years of community health efforts. And our past couple of years have been filled with really trying to expansion of centers, as well as services that are needed in the community. Our board has 5 strategic initiatives that have been over in their 5-year plan, and we're in the midst of those right now. Finding the best ways to provide care, finding the best ways to demonstrate that there's quality of care, finding out how to integrate or bring together services, even within our own boundaries. Different things separate people in terms of how we do things best. How do we fix those? And always being cost sensitive. As you know, we have 8 centers throughout the metropolitan area, and we lease those spaces, and these sites, our name will be going on them shortly, and we lease 3 of those sites from the City of Columbus, and we appreciate the availability of those sites. Our services, for most people, they think that they're limited to basically primary care, but I'd like to focus, there's a multitude of services that we do, and some are very unique for us as a federally qualified health center. Many have pediatrics, but less than half of the FQHCs in the United States have dental and vision. Very few have cardiology and dermatology, and almost none, as best we can find, less than 5 in the country have physical therapy. We have our health care for the homeless program, and we have really become very invested in behavioral health programming, and I'll speak about that in a few minutes. The highlights of the past year, besides the new CEO, and I apologize on behalf of Charlita Tavares. She had a prior commitment, and she extends her appreciation that you allowed me to speak on her behalf. Our organizational name change, and really beginning last January, a really strong partnership with the Columbus Public Health Department, where we began to, they transferred their OB program to us. That's allowed us really to take 3 initiatives in concert with CPH and Celebrate One to really do our best in the issue that all of us share, which is how do we eliminate infant death. So you'll see in the bottom 2 charts of items on this chart where we've begun training so we can really change some of the information that we give to the pregnant woman. And on the second page, you'll see the top 2 items where we've really made a concerted effort to expand both the equipment and our staffing in the past 15 months so that we can really begin to address this critical issue of how we eliminate infant mortality. We've also begun as a significant issue in terms of behavioral health service integration. What people don't know is we've done a pilot, and over 60% of our patients demonstrate some symptoms of anxiety or depression. And that leads into 2 other things. One, the number of women who are pregnant who have these symptoms, and that's not unusual both pre and post. But the other is our physical therapy program. We found that the number of patients because of pain also have significant depression issues, and we're moving those people, referring them back and forth between primary care, obstetricians, behavioralists, and physical therapy. Our 2016 focus is really in 2 areas: operational improvement and clinical improvement. And I would say on the operational side, our major issue is in coordinated services. It is so easy, both inside our organization and with other agencies, not to be well coordinated in a manner that best allows us for the patient to succeed when they're treated. In the clinical side, we really want to be able to demonstrate in some of the most highest areas: diabetes, hypertension, obesity, and tobacco cessation. These are the causes of so many things, or the symptoms of so many things, and we're addressing them very clearly, and I'll demonstrate that in a few minutes. In terms of other initiatives this year, and these are a little small in terms of the type, but dental services, we're increasing our capacity of our staff. It is the biggest unmet need in almost any community, and there's very few cases for reimbursement or payment for the services for the uninsured. We're increasing the size of our behavioral health integration. We're expanding further the staffing for our OB program. We're increasing staff for physical therapy. We're expanding our adult immunization program. And we're working with the Columbus Shelter Board to develop a recuperative care program for the homeless. Many times the homeless patient has been admitted to a hospital. When they're discharged, they have to go back to the tent or under the underpass, and they need a place to be able to have 3 or 4 more days where they can recover to let that wound completely heal. And so we're developing a program with them to do that we hope to get approval federally by March. We're expanding our hour of operations, and we're looking at how to become more innovative in terms of how we make translation and interpretive services timely, and that's the crucial issue. What have we done in terms of the past year and how we've done these things? And here's a quick summary. In terms of primary care and the use of the funds for the uninsured, and this is only for primary care patients, we expect to finish this year having provided over $2 million worth of services to people who have no way to pay. Over and above that is another $1.9 million worth of service for dental patients. And over and above that is another nearly $300,000 worth of services for vision for people who have no ability to pay. Not included in any of that is our interpretive services. While some organizations say they provide these services, it isn't timely. And so we're finding that if you don't have that service there, you really can't communicate accurately to either find out what's going on or make sure the patient understands what you're suggesting in terms of the care. And that's going to cost us over $800,000 this year in terms of providing interpretive services, not just for the uninsured, but for those who have language difficulty. Let me point out a couple of things in terms of the uninsured pregnant woman. We have some of our sites that are between 50 and 60% of those individuals, when they present themselves, they have no insurance. In terms of our dental coverage, nearly 60% have no insurance. And in terms of the interpretive language issue, over 30% of our patients this year have self-identified as English is not their primary language. And that is growing as the population grows. And 2/3 of those people basically require interpretive services or we will not be able to fairly treat them. This year,
can I ask you a question before you
Yes,
go to the
ma'am.
next slide? So in terms of the interpretive services, how do you talk to me about how you do that?
We do that in 3 ways, and we're trying to basically find out what the best response is. One way is we're working very hard to employ more and more individuals who speak more than one language. So that is one area, and that makes it even easier in terms of availability. The second one is we do contract with certain agencies to bring in people who are there. And the third is we are actually trying something innovative, and that is we are using a computerized TV kind of context where we have access almost immediately. It's called the Language Access Network, commonly known as MARTI, where they have, for languages that we can't easily find someone to do the translation, we can actually use this video contact. It's something that this Columbus Public Health used. And so we've been learning from them in terms of how to take advantage of that, and we're expanding that program. And we're being challenged in even more use of that program because more and more languages are showing up in terms of the patients that we have that do not understand English. Or if they do, it is still critical to make sure that the clinical knowledge, some words that a clinician may use may not even be translatable. So how do we make that understood? And how do we make sure we understand what a person is saying? So the 3 issues are multi-language staff, contracting with individuals to be on the standby in our sites, and trying to use some electronic telephone and TV kinds of relationships where appropriate.
Excellent. Thank you.
So on this page, I wanted to show where we seem to be at the end of the year. We believe we'll be seeing over 37,000 patients. In that 37,000, there's about 7,500 in OBGYN and approximately 6,500 in dental. You'll see the corresponding portion, which is roughly 30% of those are uninsured. And then you'll see the number of visits. It's not a perfect relationship, but basically the number because you don't know how many visits a patient might have, but basically 30% of our visits are uninsured because they relate to those 30% of the patients who are uninsured. We're expecting, based upon our expansion of our services and the demand we know, that next year we will do over 47,000 patients, of which 10,000 will be OB and over 10,000 dental. And we believe there will be a proportional number of patients who will be uninsured. And the reason we believe that may be the case is because of the growing population of this community. And if we look at the past 15 months since the implementation of the Affordable Care Act, we have now had a constant 15 months of between 29 and 30% of our patients, despite the growth of the number of patients, are uninsured. And we have no reason to suggest that won't continue.
And Reed, can you share with the viewing and listening audience, because most people would think that because we have the Affordable Care Act, that patients should not have, we should not have uninsured patients. So could you really just share who your uninsured patients happen to be?
Well, we have patients who are uninsured because of they're new to the country, where we have patients who are uninsured because they have not, they don't have the eligibility, even though there's been expansions of the Medicaid program and the criteria for the program. We have patients who move in and out of the Medicaid programs, and there's always a re-entry time. And frankly, we have some patients we know that we want to provide care for various reasons. They believe that they are not eligible, and while we try to persuade them that they are or do their best to assist them in becoming eligible, they may not be able to or may not be comfortable pursuing that course of action. In partnerships, and I think tonight is hopefully a demonstration, we believe that to leverage the money that the council and the city share with multiple agencies, both private and public, that we need to be able to work together with them to deal with both the social determinants and the clinical determinants. And so you'll see here is a list of some of the people, not all of them, that we work with in multiple ways. And let me just talk about a couple, because you've heard tonight. We are very pleased, and we have a great partnership with Columbus Public Health. We have a similar partnership with Franklin County. The ADAM Board we have several projects with related to, obviously, anxiety, depression, and becoming more involved relative to comprehensive the harm reduction. I point out there in terms of Celebrate One, that's a partner we have. Central Ohio Diabetes, the Columbus Shelter Board in terms of the recuperative program that we're trying to develop, Comp Drug in terms of the comprehensive harm reduction, COWIC in terms of we work with them in terms of some of the employees. We believe it's important for us to leverage those dollars, and most importantly, besides that, from an economic perspective, that we have to be able to make sure that various services are not compartmentalized, because a patient may not be able to get what they need because they're compartmentalized before they come to us or after they leave us in terms of care. In that context, I want to talk to you about quality indicators, if I might. And I'm going to take a few more seconds, if I might. I'm going to claim that it was okay because I answered your question, so I hope I'm not being too presumptuous. I talked about hypertension. We've been looking at pilot ways and new program in terms of what we do. Most everyone, if they have a regular physician, says your blood pressure should be at best less than 140 over 90. And we've been trying to work hard for our patients. And up to, for 2013, 2014, the beginning of 2015, about 55% of our patients that needed to lower their blood pressure is all we've not been able to get. We're the only ones we were able to get below 140 over 190. We changed our programming and did some expansion, did some other things. And for the last 6 reportable months, we're around 70%. So we're making headway, and we intend to expand that program. We talked to you about diabetes. In diabetes, if you look to the left of the chart, it's all in a blue. And the real key, any one of our physicians will tell us they really want our A1C to be below 7. If you're above 9, we got to get you below 9, below 8, into 7. So these various colors, but we changed our program in terms of a pharmacist doing the counseling as well as some other individuals doing counseling, trying to really emphasize this, as well as our nutritionists. And what you'll see over a 9-month period from July of 14 through March of 19, the most recent data we have available, that blue line is shrinking, and we're starting to see what we want. More red, more green, and more purple. In the ideal world, purple is a world but dominated. But this is how we're moving forward in terms of changing and counseling and clinically changing the treatment patterns for those with diabetes. The last one's a pilot program that I want to speak about for a second, and that's obesity, which is also the precursor of other diseases or the continuation of existing ones. And we have a pilot program where we've shown that with some counseling, weight management, nutrition guidance, new recipes, how we just advise them what food to pick, that over a 2-month period, we were able to get 85 of us sampling. It's a pilot program to lose over 5 pounds. The key to that was you want to do it over time and you want to do it slowly so it becomes a behavioral change. We're hoping that's what this is, but we're expanding this program. I talked about adding nutritionists. We even had one person who lost 40 pounds in 2 months. The last area I would lead to is we're trying to do some other things in physical therapy. There's virtually no one who pays for physical therapy or no source of funds for an uninsured patient. And so in partnership with the School of Allied Medical Professions and the physical therapy program, we've actually created a program that helps them and helps us, supervised by our staff with students in our sites, that the uninsured can get their physical therapy treatments. Its program started slowly in September. We right now have 85 patients who are coming back with some regularity for their multiple treatments, and we intend to expand that program after the new year. The last comments I would like to make is that social determinants have such an impact. And while we can't solve that unto ourselves, we recognize it's real. And so I'd like to thank publicly our staff, United Healthcare, and the Mid-Ohio Food Bank, because in the last 6 months we've been able to do a school supply distribution of school bags for 400 school bags off of High Street, as well as 200 women and men toiletry bags. With the help of United Healthcare and Mid-Ohio Food Bank, we've provided food, fresh food, to over 1,700 families over the last 2.5 months, and that's pictures of the staff doing that. And we also, last week, through our staff bringing clothes in, providing money, helping buy clothes that are new, we provided clothes for over 75 families in homeless situations. So lastly, what I'd simply like to say is we want to thank you very much for the support we received from Columbus Public Health, from the City Council, and from the administration for the work we're doing. We hope that we'll be able to demonstrate that what we're doing is consistent with the mission and the desires, which is to really help create a healthy environment for the citizens, all citizens of the metropolitan area of Columbus. And if I can answer any question, I'd be pleased to do that. Thank you for your time.
Don't walk away yet. I want to look at, so the budget you're in for almost $1.9 million, is that?
I'm sorry?
4.8 or $4.9 million is the
Yes.
budget, correct, thank you. I am, a couple things I just want to talk about that, first of all, I appreciate some of the innovative programs that you started, and I'm glad you shared information about the uninsured and what you're doing to be able to support them, because that's also a key part of having this relationship with Primary One. But I'm also very excited about looking at your key quality indicators, because we know that hypertension, diabetes, obesity certainly are, as you said, precursors to other illnesses. And so by these innovative programs that you have there, I think that you certainly are playing a key role into helping people become healthy and and move on to have great lives. I like the relationship you have with your PT student therapy program. I think that's pretty innovative also. And also, as you just mentioned, the social determinants of health, that's something we talk about all the time. Dr. Long and her team really understanding that you really have to understand the community and understand and provide resources to helping that community to move forward. So I think under working with your new CEO, I'm sure that your previous CEO had a lot of these ideas and are being implemented today. But I also know that your new CEO and all the individuals there at Primary One are certainly doing great work in our community. And that partnership that we have with the City of Columbus and with public health is certainly integral to making sure that all individuals have an opportunity to be able to have wonderful health care. And so I appreciate what you're doing. I see Nancy Bechtel in the back here, who's one of your board members, and just appreciate that, shows that great relationship between Columbus Public Health and your organization. And the other comment I'll make is certainly I know that you have taken on the OB responsibilities and the work that you're doing there, and that you're also focused, like this, the whole city is focused on infant mortality and the work that you're doing to ensure that babies have be able to be birthed healthy and also be able to live past their first birthday. So I thank you for your presentation. It is a wonderful partnership. I see my good friend John and John Coleman Tolbert, John Tolbert in the back, and I know he is who used to work with us, but certainly it's great to have that connection there and the outreach he and his team are doing too. So. The last thing, when I was in one of your facilities, the John Maloney Center, I know you had a table. I took a picture of it. The young lady was teaching individuals about healthy eating and nutrition, and I was pretty impressed with that and stopped and took some pictures of it. So I appreciate that the individuals coming and waiting for their physicians can go over and talk to an individual and learn about the healthy plate, and they're giving food and showing people what they're supposed to be eating to be healthy. So I like that, being innovative. So thank you.
So thank you very much for the time. I will pass the words on to Charlita and to our staff. I appreciate and speak for the organization. We appreciate the relationship we have with Columbus Public Health. We really are appreciative of Nancy Bechtel being on our board and helping guide us through multiple things. I have the good fortune of being the spokesperson, but I don't do any of the work, so I will make sure that your comments are shared with them. Thank you for giving us the time.
Thank you so much. Well, I want to say we have heard over the next several weeks, Council will hold many hearings on the Mayor's 2016 operating budget, and we expect to pass our budget in early February. And I want to thank all of our non-agenda speakers who came out in support of all the new innovative programs and some of the programs that aren't new but are certainly like Restoration Academy that we've now had been working on that for a number of years. But I just want to say thank you to all the people that came out tonight. I also want to thank Councilmember Page, and especially for coming out to the hearing, but also my council members who really care about this community so much that they really work hard to making sure that we are serving our community and with the highest quality possible. I also want to thank each of you who spoke today. So Hannah, thank you for being here. Dr. Long, I want to thank you, Amy DeLong, also Director DeLong, for being here and sharing your comments. Chip, thank you for speaking. I know want to also thank Susan Coleman Tolbert. I think I've thanked and Reed for being here and sharing what you're doing in the community. You know, health, housing, and health. I want to say housing because I used to be health, Human Services and Workforce Development are the committees that I really enjoy chairing because it really touches the people in a very different way and has the opportunity to make people's lives better. And so I want to thank each of you, Hannah Reed, Hannah Jones, everybody in here. Thank you guys for the work that you do each and every day because you're the closest to the people, and the areas that we are touching and the people that we're touching, as we heard tonight, there are a lot of concerns in our community. And through the social service agencies and your departments, we're helping to make sure that everyone in Columbus has an opportunity to have a great life. So thank you for what you do each and every day. I also want to thank, I'm so excited about the harm reduction program. I just don't know what to do about that. So I'm just excited about that program. But again, I want to thank my legislative research office, Tom Diamond, who chairs Health and Human Services and Workforce Development. And I also want to thank Nicole and James, who are here on my team, who work really hard, because these are big committees. I mean, there are a lot of things going on in these committees with all the agencies and the work, and just want to thank them for their hard work. I also have to thank the hardworking team of CTV they're here every night when we're having these hearings to make these hearings possible. And lastly, the residents of Columbus who allow us to do this work and to make Columbus the best place to live, work, and to pray and raise your family. And so with that, I'm going to say good night to everyone. And lastly, there'll be more hearings for the community. There'll be hearings tomorrow, on Tuesday, December the 15th, for Judiciary and Court Administration. On the 6th at 5 o'clock. At 2 o'clock on December 16th, we'll have Development, Public Safety, and Public Utilities. December 16th at 2 o'clock, and at 5 o'clock, we'll have the administration budget. And lastly, on December the 17th, we'll have the Recreation and Parks budget at 4 p.m., and at 5 p.m., the education budget. And so with that, I will say good night and thank you for being here this evening.